the difficulties involved with being a respiratory therapist. Um, there are some difficulties you run into. Some may be, if you're not quite familiar with how it is when you get patients that come into the hospital and they're not always doing too good, working in those critical care areas, all of the patient outcomes and the scenarios aren't as we wish they would be. Some of them end up a little differently than a desired outcome, but I think that's just a part of being in the healthcare field. You become, I won't say tolerant, I won't say used to, but you know how to deal with it a little bit better, knowing that you provided your best aid and care and trying to get this person back to, some kind of semblance of, good respiratory health, a good heart health, doing what you could do to, get the patient back to out of that situation. But some of those situations are out of your hands. I think the most difficult part, sometimes that I run into sometimes the patient's families. That sometimes had the power of attorney to do things that may be in the best interest of the patient, but don't always make those decisions. And I can't, be feel some kind of way because I don't know how it is to be in that position. I know how it is to be in that position, but not from their situation. Sometimes, the families could be a little bit overzealous, but you understand where they're coming from in their position because this is their loved one. And, maybe just, have a lot of questions and that you have to answer. Maybe you have to go back and do some research because you may not have the understanding or knowledge, but you want to answer it to the best of your ability. And these may be answers for the doctor or the ordering physician or the person that, created this order or this thing for the patient. But as an RT, I do try to do what's best in my power to create or to answer or to be a source of reliability and answers. And, because, they're a lot of times laymen's and lay in their understanding of what the medical devices is or that healthcare procedure is. And we're a lot of times that point of care because they don't always get the best breakdown from the other medical professionals. So when I do get in those situations where the families are a little bit extra, a little bit overzealous or just questioning things that I do, I try to remember that this is their loved one and it's somebody they care about greatly, and that they want to see this person come back to semblance to how they were before they got into the hospital. So just, being compassionate and being grateful that, the situation isn't different. I've been put in this position in order to help people, and this is what I like to do. So this is, to decide the career and decisions that I decide to make when getting into healthcare, and I know full well, and I love it. I enjoy it greatly. So yeah, that's just a part of the game that, may not be the easiest, but it's necessary.